All right, party people. Today we're going to be going over some basics in terms of physiology and how either increasing or decreasing your sodium intake would affect various levels in your blood. So to keep this simple and straightforward, let's assume that someone increases their sodium intake. How would that affect aldosterone, angiotensin II, potassium excretion, and urinary pH? Let's run through it. So increased sodium leads to increased plasma volume expansion. Normal plasma sodium is 135 to 145 milliequivalents per liter. When sodium increases, plasma tonicity increases. This draws fluid out of the intracellular space into the extracellular space, aka the plasma. This leads to increased plasma volume. Increased plasma volume leads to increased renal blood flow. This suppresses the RAAS. Renin is released by juxtaglomerular cells in response to low renal perfusion. This is suppressed when renal blood flow increases. Since renin is down, angiotensin II would in turn also be down, just as aldosterone would also be down. Now, as far as potassium excretion, aldosterone promotes potassium secretion in the distal nephron. With less aldosterone, less potassium is excreted. So potassium excretion is decreased, not increased. Another mechanism from aldosterone is that it also promotes proton, H+, secretion in the cortical collecting duct. Less aldosterone means less proton secretion, means less acid in the urine, making the urine more alkaline. So with increased sodium intake, the only thing that increases out of the options provided was urinary alkalinity, because aldosterone is suppressed, reducing acid excretion. So to sum it up, increased sodium increases the plasma volume, which decreases the renin-angiotensin-aldosterone system, which decreases aldosterone, which decreases proton secretion, which increases urinary alkalinity. All right. If we were to reverse this, for example, if we were to do everything the opposite, such as someone was to decrease their sodium intake. All right. So let's run through it. Decreased sodium intake would decrease plasma volume, would increase the renin-angiotensin-aldosterone system, therefore increased aldosterone, would increase proton secretion, would then increase urinary acidity, decreasing urinary pH. That's it for this one. Go crush it.